And there's a lot of chiropractors I watch videos of on YouTube, and a lot of them are like, what I don't like about them is like they're clickbait. Like there's always a girl with yoga pants on.
There you go. There you go. Very nice. Here we go. All right, we'll tighten on that side. I plead the fifth. I don't.
I was just wondering if you got it done because I saw your sister got it done.
I like, I think just a little traction. I use some traction to free up the vertebrae. When they're all sandwiched together, they won't rotate.
Right.
So we like a little bit of space so that they'll rotate. So you'll see me just, I'm not trying to, we're just trying to free up the vertebrae a little bit. Look at those massive triceratops.
Since my son was born, I typically hold him with my left hand or my left arm. So since that has started, basically I've been getting a lot of rib tightness.
Okay.
So basically by like when we were going to Disney, basically by the end of the day, I'm feeling it like in my ribs and my mid back.
Okay.
And it's not like a pain, but it just feels like someone's elbow is pushing in there.
Okay.
And so I'm very familiar with cupping, scrasting, scraping.
Okay.
My wife's best friend's a PT, so he'll scrape me occasionally.
The mark comes out in there?
Yeah, I'll show you a picture. I got some pretty bad rib.
Okay.
Purple. It just turned back and blue. I mean, pretty bad.
The posture of our body determines how much mechanical stress is in there. So sitting for a living, the more forward we are, the more constant muscular tension's in there. Mm-hmm. That creates a constant lactic acid buildup, and what you're seeing is the gua sha mark. Has anybody looked at your posture or tried to work on your posture before? Mm-hmm. Okay. What else?
I've seen probably 8 or 10 chiropractors since I've been alive, and nobody's talked about curves,
lordoses, and
Well, actually, I lied. Sorry to interrupt.
You're fine.
My since my son was born, when we took him home, we noticed his head was like cocked pretty hard, and he was having trouble breastfeeding. So the doctor we took him to, no, not the doctor. Like it was like a family doctor kind of, but they were supposed to help with breastfeeding and stuff like that. So they recommended taking him to this chiropractor who's really good with kids, and they adjusted his atlas and with a little gun.
Sure.
And his neck went straight, and he's been growing great. He's been going every few months, like every 1 month or 2.
Yeah, they're stuck in there to one side. Whatever side they're stuck to, they kind of favor when they're born.
So they are actually the only one that's ever talked about the curve.
The curve, okay.
Yeah.
All right.
But I think there was a video with you and your sister.
Okay, cool.
And then you started popping up on my newsfeed. And there's a lot of chiropractors I watch videos of on YouTube, and a lot of them are like, what I don't like about them is like they're clickbait. Like there's always a girl with yoga pants on.
Right.
So we were doing standard deadlifts, and I could do 495. That was like my max.
Whoa.
But then we were doing like his brother came with us, and we were doing sumo deadlifts.
Okay.
Are you familiar with that?
No.
So when you do it, you kind of go like this.
Yes. Okay.
So your hips are like more. So when I was doing that, I couldn't get 495. So then I went to standard.
Right.
And then when I tried to pull standard, a muscle in my lower back, I just felt it go like stretch out.
Okay.
And ever since that's happened, my left hip hasn't been right.
Okay.
It's been giving me issues.
The nerves that go out of your lower back go to your hip. So spraining your lower back and the hip are the same thing. Not knowing much about deadlifting, I do know about squatting, and one of the things with even squatting is that the more your feet are flared, the more stress is going to go on the inside of your knees. So, I'm just thinking out loud here. When you're doing a squat, perhaps this takes stress off your lower back, but you're going to beat up your knees.
Right.
You want to walk with your toes straight forward. If you're going to do a squat, you want to have like in yoga,
right.
You want to have your toes going straight forward.
Okay.
So that the pressure is evenly distributed over the meniscus, and not the more the foot is flared, the more we grind the inside of the meniscus, and so the meniscus doesn't have any feeling, so it's hard to connect with it until it's injured.
Okay.
When we're bending, the curve in your lower back goes straight, which then, like a ladder, all the weight goes down to your lower back. There's ligaments that hold that joint together that are under stress, especially with that much weight. Probably have a back brace on, right?
Yeah, I did.
Okay, even with the back brace, it's still, wow. The fact that you feel discomfort in your middle back means that it's at least moving. Many people, when things have gone on for so long, lose a connection with their middle back. this becomes totally frozen, and then all they feel is their lower back. So the fact that you feel something in your middle back means that your back, and that's part of why you might not be ever feeling your lower back, because you have your middle back assisting.
Okay.
So I'm going to go through, I'm going to examine and check, see how supple it is. We'll clean it up. I'm really curious to see, more about that lumbar curve. If there's a curve in your back, then placing you in that mold is easy. If your back wants to be straight, then there's a huge disparity, and therefore, it's not very comfortable. We want to support this so we don't hyperextend this.
Okay.
And you want to push this in to loosen and to start that curve.
Okay.
And it actually creates a tractioning effect on the downslope.
Okay.
But we'll talk about that in a minute. But that looks to me more of a neck device.
Yeah.
Look up. Let me show you the range of motion. Look down. Okay, turn your head left. Turn your head right. Okay. Any pain when you do that? When you turn your head around? Okay.
Oh.
All right. Let me have you on your back for me. All right, take a deep breath in for me. Head back for me. Let all the air out. There we go. All right, deep breath in. It's moving. Exhale. Let it go. Beautiful. Deep breath in. One more. Exhale. Let it go. Beautiful. Oh, take a deep breath in for me. Exhale. Here we go. All right, good. Yeah, it's a little tight. Other side for me. Yep. All right, go face up for me.
So the last time I was adjusted, it was like a month ago. I get once a month, and I never asked him to do my Atlas.
Okay.
But since my son gets it adjusted all the time, I figured, well,
He checked it?
Yeah, he checked it, and it was pretty intense.
It's out to the right here a little bit. We're going to start with the right side. This is, your head likes to tilt left. We're going to try to see if we can get this. I got you. There you go. There you go. Very nice. Wow, yeah. Gotcha. Here we go. All right, we'll tighten on that side.
Yeah, left side definitely bothers me a lot more.
Yeah, a little more resistant on that side. Let's feel here. There we go. Whenever there's an injury, your body is going to try to, lock it down, and then you lose members of your team, and we need the entire spine working as a team so we can make it to 90 or 100. Mm-hmm. And every injury or every, deadlift that hurts something, some percentage of your back has the potential to quit. And so
Right.
we're going to go through your spine and find out who's injured, who doesn't want to work anymore, and ask them why they're, well, you don't know what happened. He hurt me.
So like, one thing I did notice, like over the winter, my ribs would hurt me more and my hip would obviously bother me more. And one thing I was doing in football was doing a lot of hip stretches to help me move laterally, side to side a lot easier, because I found out if I don't stretch like an hour before a game, it's like my brain's telling me to move, but I just can't do it because I'm so tight. So it actually ended up helping my mid back and ribs from just doing like a pigeon stretch and kind of like a frog stretch just to open up my groin and stuff like that. So I stopped playing football now. So,
gotcha. Yeah, you're just you're clearing the pathway between your brain and your body so that those signals can actually move faster because you've already kind of sensitized them. You already, when you move your body around, the neurological pathways are activated, which then makes it easier to reactivate because it's like the road's been cleared. So you're.
And most of my driving career, I've been always staring at my left hand, and just watching your videos in the last few months, I've been forcing myself
to try to use the other
to
side.
use both, or just to switch the right. It's so much easier to stay centered.
I have a feeling you're like I said, your left hand top of the steering wheel. That's your head's tilting to the left.
Yep. And for years, I've always I could never crack my neck, self-cracking.
Yeah.
I always would tilt the top of my head left.
Part of it is that the left side is actually, compressed, so it's not going to make as loud a click because the distance isn't as far out of alignment. The right side is actually farther out of alignment. That's
Right.
why it's going to make a louder click or pop. And it's nothing wrong with the left side, just the distance. The subluxation is the word that chiropractors try to use. The subluxation is less on the left. You have a larger, right here is a larger subluxation.
Right.
there's a resistance to your head tilting to the right that doesn't exist on the left. And it really, we work on the atlas, not even so much for the health of the atlas, it's really for the health of your lower neck, which won't make it if this isn't working and pivoting properly.
Right.
The lower neck, C5, 6, and 7 encompass 99% of surgery. And nobody really talks about that. It's kind of the elephant in the room that you don't want to mention that 5 vertebrae have all surgery. And it seems to me that if we keep having the same problem over and over again, but we don't talk about the cause, then that problem is going to keep occurring.
So did you ever have the ring dinger, or I saw your
Yeah.
sister had the Y strap?
Yeah, I'm not my couple we don't say questions I have for those types of adjustments.
Mhm.
Well, it came from the crane condyle lift. There was an adjustment that I was taught, my dad taught me when I was young.
Mhm.
It's an occipital adjustment. You're trying to loosen up the occipital condyles from the atlas.
Mhm.
And it's much more specific, and they do some in Pedibond where you're just trying to loosen this joint, but they're not nearly as forceful, let's say, as the Y strap or the ring dinger. Couple of things I wonder. If the upper neck is tight and the lower neck is loose, and I traction you very quickly, which vertebrae are going to be moving the most?
The loose ones. Yeah.
Right. So you're just going to further move the loose ones, and the stiff ones remain stiff. So you're not really balancing the spine with that adjustment.
Right.
And then if we have disc injuries in the lower neck, those discs are like fabric. And if there's a piece of fabric that's got a tear in it, and you sit there and yank on the fabric and pull on it real tight,
Right.
it has the potential to further injure that disc. So, and then third, I guess, the neck doesn't belong straight.
True.
It belongs
Yeah,
curved.
true.
So why are we pulling it? Notice even when I adjusted your neck, I'll do it in slow motion. I'm not going to adjust you. See how your chin is up?
Yeah.
See, and I'm trying to push the curve into your neck.
Okay.
Sometimes they'll see chiropractors adjust like this. They'll have their chin down.
Right.
I'm not adjusting you. I'm just saying,
Right.
the chin's down. It's wrong.
Mhm.
I want the chin up, and we're closing the joint.
Okay.
Now, you can get a really loud pop by opening a joint. Right? Oh, wow, that was a really good adjustment. Well, not really. You just cavitated the joint open. We're trying to close the joints. And why do you want to close the joint, Ed? Because the more the weight is on the joint, the less weight is on the disc. And the disc defines the life of your spine.
Right.
The more weight that's on the disc, because essentially the disc doesn't replace, it doesn't heal, the more stress and compression that you place on the disc, the faster it's going to age. And your life, in terms of the health of the spine, is going to come from how much stress has been on those discs. Once the discs are worn out and desiccated and damaged, this is when the surgeon comes in and says, hey, let's put a rod in your neck, or cortisone shots. And so we want joints replace. So I want the weight on the joint, I want the curve in your neck, and everything I do is aimed at getting you into that place. Now, if you have patients that are, let's say, elderly, everything's sort of dried up already, it's already stabilized because they're not 20 years old, and you're just trying to give them some relief, if just symptomatic relief to like some terrible stenosis, or maybe we traction real hard to try to give some relief to some stabilized patients. But when you take a young person, 20, 30, 40, and you've got fleshy discs in there and you're yanking on them real hard, I don't know how we're not injuring them.
Right.
But I just got done telling you multiple times, the disc doesn't have any feeling.
Right.
So even if I injure your discs, feels great, doc.
Right.
Oh, geez. So it's well, it didn't hurt, Ed. It felt fine. I know, but you can't feel the disc.
Right.
So I don't know if we injured the disc or not, and you don't know either. And until at some point later in life, well, you're definitely going to know that the disc's injured now. Anything that puts stress on the disc,
Okay.
I want to stay as far away from that as possible. That's the whole idea of that device you brought in, which is to bring the arch in your spine, which unweights the front part of your neck, which the disc's on the front part of the spine. We're trying to imbibe it with fluid and rehydrate it. It's made of 70-80% water, right? So the curve restoration allows the disc to get a breather and get a break. I think just a little traction. I use some traction to free up the vertebrae. When they're all
Right.
sandwiched together, they won't rotate.
Right.
So we like a little bit of space so that they'll rotate. So you'll see me just, I'm not trying to, we're just trying to free up the vertebrae a little bit. I gotcha. Let me have this side. Let me have it. There you go. There it is. Good. One more. That was the one that was stuck there. Yeah. I think we got it. This side how it went. Let me see here. All right, good. Yeah, the left side of your back right here is all elevated, right where you're pointing.
Yeah.
Here on the left. If I put a marble in your back, it's going to roll off to the right. From here to here, the ribs are sprained outwards, or they go on posterior. This is, we want to free it up, clean it up, and then start stretching it in.
Okay.
This is not, the position of the bone is incorrect, and that's part of, and maybe, like I said, due to holding your child,
Yeah.
that's forcing these ribs out of place, and then the ribs are just staying out of place. Now the muscles that are having to work hard because the alignment is what gives stability. The muscles are now, trying to hold everything together, when in fact the alignment, the joints, the ligaments are what's supposed to give you stability.
Okay.
So,
Yeah, I was at a party, and my wife's best friend, he's a PT, and I was talking to his brother, and his brother was saying he had his eyes were twitching, and they was driving him nuts, because he had nerve issues.
yes.
And, he was saying with muscle spasms and stuff like that too, and he started taking magnesium. So I got thinking, and I went on Amazon and ordered a magnesium supplement, and I usually take 2 pills with dinner, and that seems to really help with the rib tightness.
Yeah, that's fine. Yeah, magnesium is one of the most deficient minerals.
Yeah.
Headaches, it helps. Digestive issues, it helps. Yeah, it just needs time in here. You got to work this.
Mhm.
It's pretty frozen. Yeah, this being restricted here makes the lower back, I'm going to say hypermobile. So this area is hypomobile, and then when you're bending, the spine's a volunteer structure, so therefore your lower back's going to volunteer more, and the ability to sprain it goes up when this is rigid. So having a conversation with your middle back, keeping a mechanical looseness in here, makes it harder to sprain your lower back. Now again, I can't make any promises when you're picking up 490 pounds. I think my dad and I just don't do that. But if that's your goal in life, then if you're going to be
Well, I don't do that no more.
if you want to be an athlete, you're going to have a car mechanic, and you're going to.
Right.
If you put nitrous on an engine and supercharge it and turbo, you might bust some valves every once in a while.
Yeah,
You understand?
yeah,
It's
I
like,
got you.
well, how do I not bust valves? How about you just run the engine without all the nitrous? You're asking the engine to do a lot with that. So no promises. But, if it's just picking up your kid, moving around the house, regular ADLs, we call it, activities of daily living. Yoga would be a great way to keep your spine limber. Again, they're more retainers. If the back is stuck like this is over here,
Right.
I worry that when you're doing yoga, only the loose parts are bending the most, and so the stiff parts are just sitting on the sidelines watching.
Okay.
Once we get them unlocked, it's a great way to retain mobility. But especially for guys, we don't have progesterone and estrogen loosening us up.
Yeah, it's a big problem area. Usually on either side.
Switch the other arm up here.
Is this something a massage therapist could do too, or
Depends on what. It's all. I'm gonna say.
up
It's like,
to them? Yeah.
Yeah, you're ready for stretching. I mean, there's. I can tell you've been worked on and cleaned. There's some here on the rib heads, but
Right.
a majority of the, I'm going to say surface lactic acid's already been washed out. There's some right over here that's been missed, but
Yeah, it was about a month ago when my
no, you.
wife's friend did it.
Yeah,
which there was a lot of popping in there.
Yeah, no, they've already got it. Once you get the circulation, we will say, established, the body will self-clean.
Right.
It's due to the area being so tight that cut its own circulation off and it's sequestered itself, and so getting the area back hooked up allows for it to just be autonomic and self-cleaning.
I don't really have, I may have a little bit of pain, but everyone's like, why are you driving here and going to see you? And it's more preventative. Like, I don't, like my friend, he's basically the same age as me. I think I'm 3 or 4 days older than him. But he threw his back out like 3 times, really bad.
Right. Yeah, the ability to hurt yourself is higher when you don't have your whole spine working as a team.
Right, and I mean, I'm not saying he's not taking care of himself, but like, he's not.
A lot of people don't know how to take care of themselves.
Well, right,
with their
too.
spine. They just don't.
Yeah.
They take care of themselves nutritionally, they exercise, but spinal health is not thought of. So.
Right.
Even when you're driving, there's some stuff that we can do. Like if you have a long day of driving, we can place the devices in here, up in the middle back to lessen the, we would say subluxation, lessen the misalignment, so that when you do your evening stretch before you go to bed, you don't have this large gap to try to, bridge.
Yeah, I have 2 different lumbar support pillows. I mean, one's bigger, and the other one's like a little purple. Came with the seat cushion. I just don't know where's the right spot to put it.
You want to, you actually, people think the lumbar support needs to go low, usually too much. It needs to go up here to loosen and then to initiate the beginning of the curve so it goes into your lower back. We don't want to further loosen the lower back by putting the support right in the lower back. We want to make it, we're trying to create a new bending point, like a piece of paper that you keep bending back and forth in the same crease, starts to tear. We're trying to create a new crease, a new fold in an area that's not injured.
Okay.
That's the whole rib section that you're pointing to.
Yeah.
There's some mechanical stress in there. We're going to try to push that in. That'll relieve. Maybe make it more clear. When you're upright, it should be relaxed, right? Now watch when I bend forward. See how I got tense?
Yeah.
Right? Now watch when I come back upright. It goes back to being relaxed.
Okay.
Right? So the posture and, like I said, activity of holding somebody creates that constant tension in there. Have they land you back for me?
Sure. Yeah, my wife's same guy, Jesse. He's the one that scrapes me. He did say, well, that quad is tight.
Well, that's what's going to tear up the knee.
Yeah.
Because the quad attaches to the tibial tuberosity here. So, nice, okay.
So basically what I was doing is doing this and then coming over and that, like, it's like.
Yeah, I know. See, the difficulty with that is that when you're doing that, again, these are stretches designed with the intent of getting relief quickly, which I call therapy. Right. So the goal isn't correction or bring me back to the long-term right position. It's, oh, there we go, it feels better. Right. So when you bring your knee up, the nerves go through and your lower back get larger. When you rotate, the holes get bigger. Do you understand? So on one side and small on the other side. So if we're going to do that, we better have support behind your back. The dental roll. You understand? If you want to do something like that, I would feel more comfortable doing it, knowing that your curve in your lower back is supported, not letting it flatten to the floor. I'm not saying of course it's going to feel good to do that. I just, you got to be careful because the L5 disc has no feeling. And until the disc is, we haven't had any MRIs of your lower back.
Nope.
Right.
I had one X-ray years ago.
The X-rays, we can't see the disc health on the X-ray.
Right.
But if we took an X-ray or MRI of you and it looked age appropriate, I'm going to be really quiet.
Okay.
But if I take an MRI of you and I see 55-year-old lower back, look, the crash course we're on, by the time you're 55, it's going to look 90. Right? So we need to be careful about not accelerating the aging of a structure that has no feeling. And that's why it's very confusing. It's why the only really way to evaluate the lower back is 2 ways. Obviously, 1, MRI, 2, your middle back tightness. So based on how tight this is I can then make a pretty good educated guess about how much this is overworking. Yeah, good. Yeah. Let me check this. I got you. I got you. 1 second. Me too. Look at those massive tree trunks.
Does this hurt at all? Or?
This part?
Yeah.
No,
Okay.
a little bit, but the elbow was a lot more
Okay.
intense. When I do stuff like this,
Yeah.
my stories, and everyone's like, "Oh, did you get in a car wreck or something?" I was like, "No," and they're like, and then I tell them what I did, and they're like, "Oh, does that hurt?" I'm like, "No, not really. It feels good."
You know, right here is the meniscus.
Mm-hmm.
That's what costs the most. You know, right in here, and that's what we want to. Everything is about saving this area, and the tighter the quad is that attaches down here, it vice grips and chokes the knee.
Right.
So, making sure that the quad is not, staying tight allows the meniscus to breathe. The knee in and of itself has very little circulation, even at its best.
Right.
And so, knee stretching, which I'll show you in a second, to try to stretch the quad and open up the knee. Yeah. There you go. Yeah. Get that butt to the heel. Yeah, you want to get your butt. There you go. Get that, yeah? And then the second goal is put your foot on the table like this, and then you come down inside. That's your next goal. So your first goal is just foot's over the edge, get your butt to the heel. Second goal, come down inside. And the third is you actually then put your bottom goes onto the heel. So go ahead and put the toes pointed on the table. Then like, there you go. Never let it go. Just relax. Like, don't let it ever go out or in too much. Always have it pointed. Perfect. Toes pointed, and you can come down inside of the heel. Perfect. Got it.
So, like from sitting a lot, I crack my ankles quite a bit.
Yes.
Is that just over tightness?
How do you crack them? What do you just specify?
Well, usually when I'm driving, I'll just do that, and they'll pop.
If you have that itch in there, that desire to,
Yeah.
part of that is you're stretching. You're stretching the deltoid ligament. There's a ligament on the outside of the ankle that you're stretching, and then you're, cavitating the joint. My issue with that is that over time that ligament's going to lengthen. That ligament is what provides stability to your ankle.
Okay.
It's the joint inside that's inflamed that's making you feel the desire to pop it. I'd be curious, that's, why the joint's upset to begin with, either from activities, deadlifting, or,
Well, it's mainly just from driving. Just from
the pedal.
the more active I was,
Mm-hmm.
like with playing football, it didn't seem to bother me as much.
Gotcha.
And now that I stopped, it came back.
I would try to do what I just showed you there. That's
Okay.
also a kind of a knee and ankle.
Oh,
Right.
yeah, he's
Yes.
sensible.
That's what I would be working on, and seeing if you obviously when you're driving, you might not have the ability to go find somewhere to do that.
Well, no, they give you like 45 minutes to build a set, so usually I have a little bit of, it doesn't take me that long.
That's what I would.
So that's when I have a little downtime. So what I've been doing is, I found this on Instagram. Now you tell me if it's good or bad to do.
Fine.
But you go like this, put your hands together, and then drop your head down.
And that's for the goal is to do what?
Pull your shoulders back. It seems to help a lot with my lower neck, because it's basically, we'll try it, it's
Right.
pulling your arms back.
Right. I would.
Is that good or bad?
There's no way I would do that without having to. I don't want to.
Yeah.
You can't pull your shoulders back and push your head forward to say. I don't want. See, the more forward your head goes, I don't like what that does to your neck. I would be just trying to.
Okay.
Just relax your neck.
And what I can do, then I can usually get my lower neck to pop.
I don't want that to pop. Yeah.
Okay.
Yes,
Well,
I agree.
not by doing that, but what I have to do is go like this and then
Correct.
and then pull down.
Correct.
That's no good.
Well, you're going to age your lower neck at a faster rate. We want to be as. If there's two things that I'm extremely cautious: the lower neck and lower back. There are 24 vertebrae. 5 have all surgery. These last 2 guys here and the last 3 guys in the neck. So when you're putting your head forward, you're popping your lower neck joints, which is going to age the joint. The joint will grow, bone spurs. You're grinding the disc.
Yeah.
Let's get your back into that curved position. Let's keep the arch in here. Let's try to push this in while also bringing the head back. Instead of pushing this in and then pushing your head forward, So feet together, knees together, bring your knees left. There you go. There you go, knees right. About 5-10 seconds each way, and then for the most part, for about a minute, you stay in the middle. And stay in the middle for here. Now this can be used right over that rib. The highest position this can be used is right below the shoulder blade, right kind of in that rib area.
Okay.
And I got you right now about a little bit lower here. But this whole section, that whole foot section needs to be mastered.
Okay.
It's 20 minutes is a real number for how long it takes to fatigue the ligaments, specifically the anterior longitudinal ligament on the front part of your spinal column, is what is basically it's like a rubber band that pulls us back forward.
Right.
People are teaching to strengthen your muscles to fight that ligament. I find that to be kind of silly. How about we just stretch the ligament and then your body will just want to be upright without having to have contraction. And
So when you say 20 minutes, you mean 20 minutes total?
One spot.
Oh, just for one spot in general?
Yeah.
Okay.
It's like you're just clay barring and polishing a fender. Then you're going to do the hood. You do different panels, but right now we're just going to say one spot. The roller allows you to move,
Right.
but this is more intense. The roller's contact is probably about 3-4 inches. This is more like 1 inch, 2 inches.
Okay.
So it's much more focused pressure. It's going to ask a much smaller section of that ligament to stretch at a deeper level, and then you do a different spot every time you do it. The mastering of this is the whole purpose of the table.
Right.
Everything I do on that table is to make this possible. You want to target, leg straight for this one. You want to target that middle upper neck, so you want to have as high as you can. Lay back, I got you. That it's still in but your head's going over. Does that make sense?
Okay.
Let me see how you look up again. I'm just going to have you just look at your range of motion. Now, well, a little better there. There we go. Yeah, your body how's that rib feel? How's that
Better.
feel? Awesome.
Yeah, a lot better.
Awesome. Appreciate it.
Thank you.